Hello, everybody, and welcome to this webinar. And we're just going to give a few seconds for people to join because we're expecting quite a big group. But a warm welcome to everybody. You can already start to introduce yourself in the chat function if you like. Tell us where you're from, what organization, and where you're calling in from. So as we just wait for everyone to join, I can just introduce myself first of all. So my name is Paula Quigley. I'm the Facility Director for the Nutrition Technical Assistance Facility, which is funded by FCDO. I am joined today by my colleague, Alexandra Kroski, aka Alex, who is going to be co-moderating this session with me. So just to give you a little bit of information about ourselves, I'm a public health consultant with DAI. I've been working with them for quite a few years across the portfolio of health and nutrition related work. I am a medical doctor with a master's degree in maternal and child health and over 35 years of experience working across mainly Asia and Africa. I've done a lot of evaluations and assessments and program designs, etc. And Alex, my colleague, has 30 years experience in food security, nutrition and climate change programming and working with Save the Children UK, Oxfam, World Food Programme and FAO with global experience, but a focus on East and Central Africa, and spent the last 5 years with me and other colleagues on the TASC and the NASC projects. So TASC was the predecessor of the Nutrition Action for Systemic Change, Technical Assistance Facility, and Alex focuses on integrated nutrition across the aid portfolio of FCDO with a focus on women and children. So this session is building on the momentum of the Nutrition for Growth Summit, which was held recently in March in Paris, and the launch of the Global Compact for Nutrition Integration. And so we've brought together a wonderful panel of people to discuss the issue of social protection and integrating nutrition. And we're going to be sharing some really great stories, case studies, and guidance for you, and look forward to your participation. So just a little bit of background information. The session is being recorded so that it can be shared afterwards. There will be an AI captions, and you can click on the closed captions button to see those. It's at the bottom of the right-hand bottom of your screen, probably. You can use the chat to introduce yourself, say where you're from, and make comments or share any links. But then please use the Q&A function for specific questions to the panelists as they present. You can either do it during their presentation, or you can wait until afterwards. You can raise your hand and the moderators will unmute you and you'll be able to ask your question in person. And again, please state your name, your organization, and if your question is directed to a particular speaker, please say that. Thank you. So this is how we're going to flow today. We're just going to do a quick introduction for you, give you some background context, and then we're going to have a couple of presentations, again, giving some background context, and talk about some of the challenges that have come up in our experience in the past 5 years or so and beyond. Then we're going to have a panel discussion with 4 fantastic panelists. Then we will have our Q&A discussion and then quick closing. So these are our speakers today and our panelists. We have Abigail Kaplan-Ramaj, who is another colleague with Alex and myself on the NASC team. Abby is a senior nutrition advisor with DAI's NASC facility, and she was previously also with TASC. She provides technical assistance across Africa and Asia, again, strengthening the integration of nutrition throughout programs and national systems. And she brings over 15 years of experience in global health and nutrition. She's also worked with UNICEF, Nutrition International, the World Bank, and Save the Children. And Silke is a global health expert with a master's in health policy planning and finance and more than 20 years of operational and policy experience gained across Africa, Asia, and Latin America. She has particularly strong expertise in nutrition, sexual and reproductive health, global health security and health systems, and her current position is acting team leader and senior health and nutrition advisor in FCDO's nutrition policy team. And she has had previous positions at FCDO in global health security and health and nutrition advisor in Zambia. She's also worked for almost 8 years in the design and implementation of multi-sectoral nutrition program. So, and she has a director level position, has held a director level position at Options UK. So we're very delighted to have Abby and Silke, who will give us some background information. And then we have our 4 panelists, who I'm not going to introduce in detail because Alex will be doing that later. But we have Richard from Nutrition International. We have Nicola from FCDO Zambia team. We have Shalini Roy from IFPRI. And we have Tafara from the World Food Programme and the Ethiopia Country Office. So this is continuing a conversation that has been happening already on this socialprotection.org platform. So there have been 3 previous webinars already, one on strengthening social protection for better nutrition with insights from the Asia Pacific, which Richard was a key part of, with the Asian Development Bank. Then there was one on nutrition sensitive social protection across the humanitarian development peace nexus with FAO. And there was unraveling paradoxes, social protection for inclusive food security nutrition with the World Food Programme. And then there's also a blog there. You will be receiving this presentation afterwards, and you can click on all these links and find out more about these webinars and the blog at your leisure. So, just to set the scene initially, why is nutrition integration important? Well, obviously it embeds nutrition goals across multiple sectors. And we know the most important sectors are health, food, water, education, social protection. It tackles immediate causes, for example, diets and feeding practices, and the underlying causes, so systems and access and equity. It promotes co-benefits, particularly gender equality, climate resilience, poverty reduction. It aligns with the nutrition policy marker, which is an accountability marker. It's central to achieving the the Sustainable Development Goal number 2 of zero hunger and ending preventable deaths by 2030. And it supports successful operationalization of the nutrition for growth commitments that many countries have made across different sectors. And there's a range of examples given there, and we will be talking in detail about some of these examples. And finally, it aligns with the FCDO and the Sun Movement Global Compact on Nutrition Integration, which you're going to hear more about in a minute. So I'm going to hand over to Silke from FCDO. Silke is going to tell us a little bit more about the Global Compact. Silke, please.
Thank you. Thank you for that introduction, Paula. And hello, everyone. I'm delighted to be here to discuss how to strengthen the integration of nutrition into social protection. Because as Paula said, and as we know, this is important to maximize the resources that we have and to maximize impact on nutrition and wider health outcomes. And I want to say that I'm really excited about this webinar because it is really much about implementing the aspirations of the Global Compact on nutrition integration. And I'm going to tell you about it now. But first of all, I want to draw your attention to this photograph, which was taken at the launch of the Compact at the British Embassy in Paris during the Nutrition for Growth Summit, which took place in March. It was really high level. It was a lot of work for all of us and those involved. And it was launched by the UK Minister for Development, Baroness Chapman, which is there on the green dress, together with the World Bank, with the Children Investment Fund Foundation, with IFAD, and with the government of Nigeria. So there was quite a big Nigerian delegation. And she was joined by her French counterparts, so the Minister for Development, Swahili, but also by very well-known champions like King Letsi III of Lesotho, who is the tall man on the right of Baroness Chapman, and representatives from over 50 countries with very strong African representation, but with at least 15 ministers of health and finance, not only health, but ministers of finance and planning attended. We also had a lot of representatives from international organizations, parliamentarians, including from the UK, private sector and civil society. So this is to give you an idea of how high level the event was. Next slide, please. So, but what really is maybe just one thing for those of you that might not be as familiar with the Nutrition for Growth summits. They take place every 4 years, ever since the UK hosted the first one in 2015 following the Olympics in London. And basically they are the key global event to mobilize both financial and political commitments to address all forms of malnutrition. So they're really important to raise momentum and commitments. So the last one was the one in Paris. So what the compact really aims to do is to accelerate action to end malnutrition in all its forms. So we are talking about undernutrition and overnutrition, to help achieve the global nutrition targets and SDG 2, because as we know, whilst we have made some progress, a lot of the targets are off track. And obesity, for example, is off track in every single country. And so it tries to do this by bringing together different stakeholders as a coalition, and bringing those that have committed or are willing to commit to integrate the nutrition objectives into their policies, programs, and investments across the various sectors that Paula has mentioned. So far, we have had more than 80 organizations or members join the compact, and we hope that there will be more. And these include governments, mostly a lot of countries that are part of the Scaling and Nutrition movement have joined, but we also have multilateral organizations, we have donors, we have some philanthropies, we have financial institutions like some of the regional development banks who have joined, civil society, private sector, and also research organizations. So it's really becoming like a big coalition or movement. One more thing that the compact wants to do, I think is missing on this slide, is to unlock financing for nutrition from other sectors, and to really seek co-benefits, as Paula was mentioning. So for that, we are going to need a strong narrative of why it is important to integrate nutrition, not only in social protection, but in other sectors like health, like economic growth, climate, and the environment. That's some of the work that we, as members of the coalition and the compact, will have to do. I think the reason why it wants to mobilize resources and unlock funding from other sectors, especially we think there will be an opportunity from the climate funds, is that, as we all know, we are living in a context of really constrained resources, so we need to do more with the money that we have available. And that's really key to the vision of the compact. I would also like to note that the concept of nutrition integration is not new. And in fact, many partners, for example, many some countries have been trying to integrate nutrition integrations across multi-sectoral programs for well over a decade. So it is not new. And what it is trying to do is to raise the profile of nutrition integration on the agenda. And this is a key piece of feedback that we have got from stakeholders that have joined. But what this is doing, or what the compact is doing, is to raise the profile of nutrition integration at a time when we are seeing a decrease in other resources. And it's really very much in line with the vision of M4G Paris to place nutrition at the heart of the development agenda, and also the call for all stakeholders to make commitments to scale up both nutrition-specific and nutrition-sensitive interventions to address all forms of malnutrition. So I think that the last thing I would like to mention is that because nutrition integration, as I said, is not new, the way we want to go on about implementing the compact is bringing in others, mobilizing and supporting implementation of commitments that have been made as part of M4G and beyond, through really building on lessons, on past efforts, sharing our expertise and experience, coordinating and collaborating in addressing key challenges. And in this sense, I think this is a really, as I said, really exciting webinar, because it's what we are going to be doing today, discussing how, both the challenges and opportunities to better integrate nutrition into social protection. So I'm really looking forward to hearing from all of you, and also to discussing and sharing ideas about how we take the compact forward. Thank you, and pass over to Abby.
Thank you, Silke, and hello, everyone. Good morning, good afternoon. My role today is to set the stage for our discussion. I'll focus on how social assistance can be better used to improve nutrition outcomes among those most at risk. And I will be drawing on DAI's guidance on nutrition-sensitive social protection, and as well as our monitoring and evaluation framework, and also a momentum we've seen from the recent Nutrition for Growth Summit. After I finish, we'll do a quick Mentimeter exercise so you can share what you see as the main challenges are to integrate nutrition into social protection from your own experience. And then after that, Richard will take us deeper into program design, followed by the other panelists. So next slide, please. Thank you. So social protection is one of the strongest delivery systems we have for reaching people who are most nutritionally at risk. Those include children under 5, pregnant and lactating women, adolescents, especially girls, and as well as people with disabilities, and those living in slums and remote areas, or those who have been displaced. And the evidence is clear. Social assistance helps households improve dietary diversity and food access. It also can increase the uptake of essential health services like antenatal care and postnatal care, as well as child growth monitoring. And importantly, it builds resilience, giving families a buffer against shocks so they don't need to resort to harmful coping strategies. And right now, we feel there's really quite a lot of momentum, as Silke said. At the Nutrition for Growth, over 500 commitments were made, worth nearly $30 billion, and 3/4 of them linked directly to health and social protection. So that said, there's a major opportunity to embed nutrition into these systems at scale. Okay, next slide, please. So this slide shows, it draws from our M&E guidance. It shows how social assistance connects to nutrition outcomes, and it follows the UNICEF conceptual framework and mirrors what we've set out in the task and NASC monitoring guidance. So we have at the enabling level, looking at how transfers provide resources, cash, or food, and when combined with nutrition and education, they can strengthen women's ability to make nutrition positive decisions. And we all know the outcomes are stronger when women control the transfer. And then these enablers shape the underlying determinants, the food security, feeding environments, and access to safe wash and health services. Then at the immediate level, we see improved diets, more diverse and nutritious foods, and increased use of services like antenatal care and postnatal care and growth monitoring. So the evidence also shows that impacts are much stronger when paired with behavior change communication and complementary services, the cash plus approach. And finally, all of this leads to better outcomes, we hope, improved maternal and child nutrition, lower rates of stunting and wasting, and strong resilience to shocks. So next slide, please. So what does it take to design a program that really can deliver on nutrition, social protection program? Well, we've identified 5 priorities, which should all be familiar to you. So the first is targeting, that programs really must intentionally reach nutritionally vulnerable groups, not just the poorest in general. The second is adequacy. The value and the length of the transfer should reflect the cost of a nutritious diet. Small or irregular payments won't make much of a difference. Then we have Cash Plus. So as I said earlier, that's combining transfers with other services, linking families to health, nutrition counseling, WASH, agriculture, or education. And then we have conditionality or labeling. So, and this can be used that can be useful to encourage antenatal care visits or growth monitoring or nutrition sessions But it also must be feasible, this conditionality, and not create additional barriers to access. And the last sort of priority area is shock responsiveness, where it's important that programs must be able to scale up quickly during crises so that nutrition gains aren't lost. Next slide, please. Thanks. So even a well-designed program or well-designed programs won't deliver on nutrition without strong delivery systems. So I listed sort of 4 areas here. The first are management information systems and data. Most systems already track beneficiaries and transfers, but very few track nutrition outcomes. So there could be some simple indicators like whether transfers are reaching children under 5 or pregnant or lactating women or adolescents, or whether families are attending ANC or growth monitoring visits, or whether diets really are improving using dietary diversity scores. Second, communication. People need clear information on their entitlements and how the transfers can support nutrition. This means that messages need to be accessible in local languages, designed for low literacy populations, and inclusive of people with disabilities. Third, we have payments. Transfers must be predictable, timely, and safe. Mobile money and local agents can help, but only if women can access and control them. And irregular or delayed transfers can really undermine trust and impact. And finally, we have accountability and feedback. Feedback and grievance systems will reduce exclusion. They give people voice, and they allow programs to adapt. And without this accountability mechanisms built in, we risk designing systems for people instead of with them. Next slide, please. Okay. Policy and financing. So to sustain nutrition-sensitive social protection, we need the right enabling environment. So this means that nutrition must be explicit in national strategies and legal frameworks. It's often implied, but not directly written in, and then it can be overlooked. The second is financing. Donor funding can help pilot innovations, but long-term impact depends on domestic resources and also scaling up these pilots as well. Without predictable and sustained financing, it's going to be difficult to maintain nutrition outcomes. So the third is tracking. We need to know not just how much is being spent, but whether it's actually reaching the nutrition objectives that are set out. So having transparent financial tracking can build accountability, but it can also strengthen the case for investing more. And lastly, coordination. We all know, or most people on this line know, that nutrition is multisectoral by nature. It doesn't sit within one sector. So social protection must work hand in hand with health, with WASH, with ag, food systems, education. And this requires a capacity and alignment of systems. So efforts can reinforce each other instead of running in silos. Next slide, please. So this is my final slide, and it's a bit, I'm just going to start with the opportunities and some of the challenges ahead, and we're going to discuss this more later with the panelists and during the Q&A. So I'm going to start with the opportunities because they're quite clear. We can scale nutrition responsive safety nets, backed by sustainable financing and stronger governance. And this really means moving beyond short donor cycles in embedding nutrition objectives into national budgets and fiscal frameworks. It also means using multisectoral coordination platforms like nutrition councils, sun platforms, and others to sort of align priorities across health, ag, WASH, and social protection. We can reduce access barriers by simplifying enrollment and improving outreach, and strengthening grievance systems so that they are inclusive and responsive. We can also improve the interoperability of management information systems and embed referrals so that a family receiving a transfer is also linked to nutrition counseling, maternal health services, WASH, subsidies, or other agriculture support. We feel that Cash Plus should be the norm, that transfers are systematically linked to behavior change communication, could be fortified with supplementary foods and school feeding or health visits. And we strongly feel that all programs must be shock responsive, especially now, able to scale rapidly in crisis while protecting, not just the calories, but overall diet quality. So I'm going to talk about, I think, we feel that these opportunities are there and they're achievable. I'm going to quickly talk about the challenges before we close, and we'll dig more into that later. Nutrition is still rarely explicit in policies, and where it is, financing is often volatile. Different ministries often, as we said, work in silos with no kind of shared accountability for nutrition outcomes. At the enrollment stage, we've learned that exclusion is quite common, and women and adolescents in displaced populations or people with disabilities can be left out. Grievance systems are weak, and seasonality of vulnerability is rarely accounted for. And even when households are reached, we know that cash alone can rarely shift diets. Weak market limit availability and affordability of nutritious foods. Women lack control or time for care, which constrains the impact on feeding practices. And lastly, accountability is a major gap. Monitoring focuses on coverage, number of households reached, transfers delivered, rather than whether diets are improving, services are used, or malnutrition is reduced. So without kind of digging into all the challenges, which we will raise later, I'm going to sort of close that by saying that their opportunities are there. We're at a bit of a crossroads. Opportunities are there to make social protection work for nutrition, but we also need to address these systemic challenges of financing and governance and equity and measurement in order to build on the opportunities. So without further ado, I'm going to suggest we go to the next slide, which is the Mentimeter. And if you could all take your phones out and scan the QR code and tell us, in your experience, what are the main challenges to integrate nutrition into social protection programs? And Alex is going to take over from here. So thank you so much, everyone.
Great, so thank you everyone. I'm hoping that you're managing to access through the QR code or through the Mentimeter code. We'd really like to see all your answers, and you can put more than one. And we invite all participants to give some challenges. So in your experience, what are the main challenges to integrate nutrition in social protection programs? And we hope to revisit some of these challenges when we get to the Q&A session. But some of those challenges which maybe the panelists will address and talk about and look at different opportunities. So we'll just give it a few minutes. Thank you. We've got some of the results coming through now. Thank you, Anna, who's busy working at the background. So we've got a few results coming in. Yes, like Abby said, nutrition is not explicit enough. Financing resources, we know that that's an issue, and coordinated finance. Some of the sectors are very siloed, some of the government and ministries are siloed as well. There's a big struggle with coordination. You have to have an intentional design right at the beginning. I think that's very key. That's come up quite a lot. Institutional capacity, not necessarily nutrition as a prioritization. When we take it from design, sometimes there's a weakness when at the next step into implementation, expecting too much and too little investment. So again, talking about resources, siloed, alignment between nutrition and social protection teams on program objectives, that can be a challenge. We've seen that when looking at some of the FCDO programs as well. Financing, short-term thinking from donors. There's more coming in, but I think we can get a sort of common message here around siloed coordination, capacity, implementation, and financing, joint funding and financing. And then again, I think there's always the challenge when you come to the M&E. I know that some of the panelists are going to be talking about that, is how do we manage to monitor the impact of a social protection program on nutrition, positive nutrition outcomes. And then the challenges of enrolling the most nutritionally vulnerable, the challenges of targeting, fragmented policy, weak government capacity with multi-sectoral coordination. We mentioned that. There's a nice example in Kenya, sort of a fragmented policy and institutional frameworks. Nutrition and social protection in Kenya falls under different ministries. I think that's quite common across other countries as well. Yeah, and then monitoring the inadequate data. Okay, well, I think that gives us a really rich examples of where the challenges are and what you're experiencing. I think now we'll hopefully revisit some of these challenges in the text, the question and answer sessions as well. But if we could just move on to the panelist session. You go to the next slide, Anna, when you're ready. So we're very lucky today to be joined by 4 experts on our panel. We have worked with some of the people on this panel, so it's wonderful to have them with us today under this DAI NASC webinar. I'm just going to introduce them very quickly. We have Richard Morgan, who is the Program Director of Social Safety Net Programs from Nutrition International. He's the global lead, and he helps leveraging social protection programs for nutritional impact. He works very closely with the African and Asia Development Banks, and previously he's worked with Plan, Save the Children and UNICEF, focusing on child poverty and women and children rights, with experience in Botswana, Namibia, and East Africa, and probably beyond as well. Then we're going to have some great examples, some country examples. So Tafara will follow Richard with a country example from Ethiopia, talking about the fresh food vouchers under the Social Protection Programme. Tafara is the head of nutrition at the World Food Programme in Ethiopia, and she's also worked as the provincial nutritionist in Zimbabwe. And then Nicola, we've worked very closely with Nicola last year at FCDO, looking at nutrition integration across some of the FCDO programs there. Nicola is the Human Development Team Lead in FCDO Zambia, and she's also worked with FCDO in DRC and previously with Oxfam in Myanmar. So we really greatly look forward to hearing about a little bit about the shock responsiveness of the programming in Zambia. And then finally, we're going to be joined by Shalini, who is one of the senior research fellows in IFPRI, and she focuses on poverty and gender. And she has worked for IFPRI for many years, seeking sustainable solutions for ending hunger and poverty, with research focusing on social protection and focusing on gender and nutrition. She spans experience across South Asia, Africa, and Latin America. So before we move into the panelists, I would just encourage participants to share any questions you have in the question and answer box. And if you want it to be directed to one of the specific speakers, please indicate in the Q&A box. So Richard, if I can hand over to you, looking forward to your presentation and some reflections from your experience under Nutrition International from Asia and Africa.
Thanks very much. Hi, everybody, and thank you to the organizers. Let me say, first of all, I'm probably not going to add much to what was in the Mentimeter as well as in Alex's previous presentation. I think all the points that I've included have already come up, so I'll try and be really brief, but I'm going to draw on experience. Firstly, work done by the Social Protection for Nutrition Collective, which is a new group that we formed a few months ago. It's an informal group of like-minded, and if you're interested in that, please contact me. As well as experience that Nutrition International has had in doing assessments at the regional level of opportunities for integrating nutrition with social protection. Firstly, across Asia, where we published in association with the Asian Development Bank, and secondly, in the SADC countries of Southern Africa. I'm looking at this from the point of view of three main modes of social assistance: cash, food, and school feeding. Not going into wider areas of social protection, which of course are relevant, like social insurance, livelihoods, etc. Next slide, please. We're looking here at some of the elements that can enhance the nutritional impact of cash-based transfers, potentially. A lot of them, as I've said, have already been raised. Improving coverage to include nutritionally vulnerable or affected populations, and targeting as well to, for example, on the basis of age or other criteria that correlate with nutritional outcomes. Complementing with nutrition information, for example, through social behavioral change communication. Co-delivering with nutrition supplements and other supplies that can support good nutritional outcomes. Conditionalities maybe hasn't been mentioned specifically, but here we're looking at what I call supportive conditionalities rather than punitive ones. In other words, that leverage cash in order to encourage the use of health facilities and services like antenatal care, immunization, and growth monitoring, and local services that need to be readily accessible to social protection beneficiaries and of adequate quality. And lastly, as was already mentioned, the intentionality of including nutrition in the design of programs at the level of goals and indicators of progress, both of nutritional outcomes and of intermediate change along different pathways towards improved nutrition, such as improved diets. Next slide, please. When we look at food-based transfers, the picture is largely the same, with the exception of, obviously, of the first point, which is to look at the quality of food either provided directly in kind or included in the basket of, for example, food vouchers that make different foodstuffs available to families on a free or subsidized basis. Ideally, these will be fortified and or nutrition-rich foods relevant to local diets. Otherwise, as before with cash, combining with nutrition-specific interventions and commodities, complementing with nutrition information, and including nutrition in the program design. Thirdly, school meals. A lot of work been done on this, obviously. Next slide, please. Oops. Lost my school meals slide. I think we've lost about 3 of my slides. Alex? No?
Hold
Okay.
on a minute. We will find them.
All right, I'll just talk to them. I had another slide on school meals, which is looking on the one hand at the quality of meals provided to students, some of whom will often be nutritionally vulnerable, including adolescent girls who may be iron deficient in many contexts. School meals should be assessed for quality of diet and not only for coverage, but also the opportunities to leverage school meals and complement them with nutrition interventions like iron supplementation, as well as complementing with nutrition awareness. There we go. And complementing with in-school health and nutrition programs around things like hygiene and water supply in schools. And a number of countries have also used school meals as a platform for involving parents and wider communities and increasing nutrition and promoting better nutrition and dietary practices in the wider community. Next slide, please. Summary, and these have been touched upon across many, even almost all countries, issues of targeting, eligibility, and coverage gaps. One of these arises from the practice generally to target social protection transfers onto poverty criteria without also considering nutrition and other vulnerability criteria. So targeting by poverty alone tends to be relatively or very inefficient, arguably, in terms of having nutritional benefits, because poverty and nutrition don't, while they overlap substantially, they don't directly correlate. So it would be encouraging for some countries to look at nutrition-related criteria for targeting and eligibility, as well as to make grievance and demand-based mechanisms also available for people to claim benefits. A lack of monitoring, as has been mentioned, relating to nutrition-related indicators within social protection programs, and certainly lack of evaluation on the impact on drivers of nutrition, underlying causes, as well as nutritional outcomes in social protection. Finally, just to summarize, last slide, next slide, please. Intentional design really jumps out, and part of the work we've been doing with the African Development Bank is to find methods and templates for prompting the integration of nutrition in the design of projects and programs at the level of goals and objectives, nutrition-focused components, including complementarities, Cash Plus, for example, and also embedding indicators within program design. The very last bullet point there is about multi-sectoral coordination, which has also been mentioned. And I just want to reinforce the point that has been made that while many nutrition plans and policies incorporate social protection, we've found relatively few social protection policies and plans which incorporate nutrition explicitly. One positive exception that we've found, just to mention, is Malawi, which with support from UNICEF and others has developed a nutrition sensitive social protection operational focus explicitly. Let me stop there. Thank you very much.
Thank you, Richard. I'm so sorry about your slides. I'm not sure what happened there, but we did manage to see them. So thank you very much. And a really good insight to the coverage and targeting, conditionality, and nutritional outcomes of school meals as well, which I think is really useful. So I'll hand over to Safara now, if you can come in and give us an overview of what WFP is doing with their Fresh Food Voucher program in Ethiopia.
Okay, thank you very much. Thank you very much, Alex. Good afternoon, good morning to everyone. I hope you can hear me clearly. So we have been doing as WFP what we call the Fresh Food Voucher in Ethiopia since 2018. It is targeting, if you go to the next slide, please. So the Fresh Food Voucher is a prevention activity in WFP, and it is supposed to prevent all forms of malnutrition. And it looks at targeting vulnerable populations with improved food consumption. And here we are targeting mothers and children in households that are receiving what we call PSNP. PSNP is the social protection program run by the government in Ethiopia. So this targets the poorest of the poor within highly targeted districts. And in this targeting, the Fresh Food Voucher is cash-based, or an e-voucher that we transfer to the households, and the components is the cash transfer itself that we give for the whole household, not individually. We have social and behavior change. We have the market support. Then we have the partnerships with the health sector, the education, and we also do capacity development, particularly for the health sector. I've already mentioned that we are targeting food insecure households that are targeted by the National Social Protection Program. Then the secondary targeting is these households need to have a pregnant or breastfeeding woman or children under the age of 24 months. So this is for the first 1,000 days. Then the food basket that they are supposed to get is vegetables, fruits, and eggs. But they get an amount of money via SMS. It is transferred. It's a digital voucher. It is transferred to their cell phones. Then they go to the local market and redeem. Why are we doing this fresh food voucher? So what we realized from our different assessments that we've done in Ethiopia, the nutrient gap, the cost of diet studies, we found that most of the interventions, including the PSNP itself, give mainly cereal, oil, or cracked lentils as the basket. And all of these are lacking particular micronutrients. So if you look at the graph, if you look at the diet that the foods that are being given by PSNP for the whole household, if we look at even with a nutrition supplement that WFP gives, which is the super cereal, we are not reaching a target for micronutrients for pregnant breastfeeding women and girls, as well as the children under 23 months. So all of our assessments show that there is a critical nutrient gap, particularly for the vulnerable nutrition groups. Please move to the next slide. So the fresh food voucher is a partnership with the government of Ethiopia, WFP, and our financial service providers. And what we do there is we do demand generation with a tailored social and behavior change communication. And we also have the monthly digital SMS-based voucher through our, that is controlled for the households. So what we tried to do is make sure that the households cannot redeem for non-fresh foods. They can only redeem food for fresh foods only. And the redemption is in remote rural markets against fruits, vegetables, and or eggs. And we promote the consumption of nutrient-dense foods. The transfer is set based on the household size. So I've just given an example, and it is set based on the market prices in the different locations. So currently we have this fresh food voucher in Amhara, in Afar, and in Somali. These are regions of Ethiopia, and there we have different values for different household sizes. Next slide, please. So here I'm just showing you an example of the social and behavior change activities that we do for the fresh food voucher. It started with a formative research in the areas that we are operating. So we have printed materials, we have community theaters, we have nutrition counseling that is ongoing, we have community radio shows, we have cooking demonstrations within the particular communities as well. And just also here in Ethiopia, there's a very big coffee culture. So coffee conversations are one of the ways that we use to communicate with the different people. Next slide. Next slide. Okay, so the coverage, so we have been in 18 waradas, and the average monthly transfer is about $1 million across the different areas. If you allow me to move to the next slide so that I don't take you back to the same things. So with the learning that we've had from the fresh food vouchers, we are now implementing a program on the strengthening of nutrition sensitivity of social protection in Ethiopia. And this is policy dialogue with the PSNP platform, which is the government platform, as they create the next PSNP. So they are currently in a design phase. They are moving from the last PSNP 5, which is the social protection. They are moving to PSNP 6. And what we have been doing is talking to the government and coming up with packages for making sure that nutrition is fully integrated into the PSNP platforms. The last slide that I need to present to you is on the challenges and opportunities. So there are quite a number of opportunities if you look at Ethiopia, as the government has endorsed the nutrition sensitive gender transformative packages that we have developed. There are a lot of integration potential in terms of school meals, in terms of strengthening of value chains, the gender building on existing provisions to move from gender sensitive to gender transformative approaches, the multi-sectorial action, including WASH, health and education and agriculture, then the scalability, looking at the pilots that we are currently doing and how they can be scaled up into the PSNP 6 as the government moves forward in the next 5-year plan for the social protection. What have been the challenges? I think the challenges have been very clear from when we started, policy and institutional, the program design itself, looking at what we have implemented in the past and what we want to implement, the operational and delivery. So the frontline capacity at grassroots level is uneven across the different regions. And finally, just to echo that, the monitoring and evidence with limited tools and the cost for tracking the outcomes remains one of the challenges as we design the next phase for PSNP. If you allow me to stop there, Alex.
Great, thank you so much, Tafara. That was incredibly interesting example from Ethiopia, which really shows a voucher scheme that builds into some bigger PSNP programs in Ethiopia on social protection, especially around the frontline capacity and the layering of the importance of layering different interventions across the different sectors. So now I invite Nicola to come and give an example from Zambia, from their challenges and opportunities in nutrition integration.
Thanks, Alex. We can just move on to the first slide. Thanks. So just to give you, this is giving you the donor perspective now. And don't want to spend too long on this slide, but just to give you a really brief overview of the context of Zambia. So the nutrition situation is pretty bad. There has been some progress. For example, the stunting rates have come down, but the stunting rates are still at around a third of the population of children under 5. And food security is also a real challenge, particularly when Zambia is hit with droughts and floods. And you can see that reflected in the IPC data, showing a lot of the population in a kind of crisis situation. And then following on from Tafara's presentation, the cost of a nutritious diet is really, really high. And WFP have done some really interesting analysis on the cost of a nutritious diet, which is about double, what an energy kind of intensive diet would be. So if you just look at the next slide, you can see, their analysis of what makes up that diet. So then, what are we doing about this? On the next slide, again, don't want to spend too long on this, but just important to understand where we've come from. And we have had a big kind of multi-donor, multi-sectoral program in Zambia, focusing on the 1,000 Most Critical Days program, which is the government program. And so the Scaling Up Nutrition program was delivering a lot of these government objectives. So that's coming to an end. Other things that we've kind of been supporting is through 1,000 Days Social Cash Transfer Nutrition Pilot, which is like a cash top-up. And UNICEF was working with the government on this. The Zambian government has a really strong social cash transfer program. That's kind of similar to Ethiopia. And this is run through the Ministry of Community Development and Social Services. And then we experimented with this kind of pilot, this 1,000 Days pilot, which worked through Ministry of Health. But then it's complicated with this multi-sectoral kind of context with the National Food and Nutrition Commission actually being the kind of coordinating body for nutrition in Zambia. So this pilot came to an end. It kind of aimed to improve dietary diversity, nutrition choices through this Cash Plus component, which was only about 75 kwacha a month for a household. And then also through nutrition counselling, through community level and also at health facilities. So we did see some really positive results from this pilot. And one of the main things that it did do was provide this kind of evidence base that this was a really important kind of population to bring into the social protection system. So when the drought kicked in last year and the government kind of expanded its social cash transfer program to an emergency cash transfer program, we were able to actually work with the government to introduce a new criteria, which then brought in 1,000 days, breastfeeding and pregnant women to be eligible recipients of the emergency cash transfer. And then this was also brought into the main social cash transfer guidelines. So that pilot ended, but the government was still really interested in sort of exploring this further. So it's been taken into a new multi-donor trust fund program called Jewel 2. It's sort of the follow-on from Jewel, which is like how the government is how donors and the World Bank support the government to strengthen its social cash transfer program and sort of build up these kind of cash plus interventions. So we see that as kind of the main opportunity going forward. Next slide, please. And so we brought in NASC Facility to help us do some thinking on how, with, as we mentioned earlier at the beginning, with little resources, where can we have an impact? And the NASC consultants came up with some analysis for us. They really honed in on the social protection integration. And one of their kind of evidence pieces that they presented to us was a UNICEF study, which pulled out these kind of ingredients for success in nutrition integration. So we've talked about the values come up a lot in the discussions, and you can see from that fill the nutrient gap kind of analysis of the cost of a nutritious diet, that the value of this nutrition top up is really quite low actually compared to the cost of a nutritious diet. And also the basic social cash transfer is not indexed. So, when prices rise, obviously your money goes a lot less further. Behavior change in the Zambian context. So we're also taking those lessons from Sun 2 and the pilot and trying to embed these into the Jewel 2 program. Multi-sectoral coordination, I've spoken a bit about that in terms of the challenge of sort of working with the Ministry of Health, which now has a new program implementation unit to kind of deliver this, the nutrition sensitive activities through this second phase of the multi-donor trust fund. And then the really important bit is this potential to scale and the shock response. And I think there's probably a lot more that we could do and explore in terms of kind of linking the indexing, sort of linking of the indexing of the value of the transfer, linking it to also early warning systems, and really exploring how we could strengthen those systems there to be able to respond to these shocks, which are unfortunately predictable in that they'll come regularly. So onto the final slide then on our challenges and opportunities. I think you can see on the right, we've talked a lot about these challenges. The financial commitment is a huge one. The multi-sectoral coordination, the politics of it is both an opportunity and a challenge. I think from the Zambian government, we've seen a real commitment, and it is actually one of the countries that has got nutrition integration in social protection in its new national social protection policy, which was launched earlier this year. So that's a really positive hook to build from, and is also at the summit, the Nutrition for Growth Summit that Silke was mentioning earlier. The government made a commitment to reduce the stunting target to 15% by 2030, which is a really ambitious target. So just to wrap up, we see quite a lot of opportunities through this new Dual 2 program, both in terms of the nutrition specific interventions through this nutrition pilot, expanding the 1,000 days, bringing in the lessons from Sun 2, and then also in terms of nutrition sensitive interventions, some of those things that have been mentioned earlier by Richard as well, in terms of, what could we do through skill feeding, what could we do through enhancing the nutrition sensitive activities within the Supporting Women's Livelihoods program. And then finally, another key opportunity is around institutional strengthening and decentralization as Zambia goes into this new kind of decentralized program. And there are kind of opportunities to get in there early in terms of how we integrate nutrition into these systems, particularly building on this Cash Plus model. I'll stop there. Thanks very much.
Thank you, Nicola. That was incredibly interesting. Really appreciate your learning from pilots and the challenges of scalability from a pilot, but also taking forward the learning and being able to expand to an emergency cash transfer program when you're faced with climate shocks or other shocks. So very interesting. Thank you so much. And then we'll hand over now to Shalini. You're going to give us some examples and findings from your research in Bangladesh.
That's right. Thank you so much. So I'll be speaking to how to align nutrition-sensitive social protection with gender and climate, as you said, with an example from Bangladesh. Next slide, please. So to start with that anchoring example, I'll share a case study from Bangladesh where a pilot program showed the benefits of aligning social protection, nutrition, gender, and to some extent climate, and ultimately informed a large government program. So the Transfer Modality Research Initiative, or TMRI, was a 2-year pilot program started in 2012, run by WFP and evaluated by IFPRI, aiming to inform policy in Bangladesh. It was a randomized control trial focused on understanding what transfer program designs could improve food security and child nutrition. So TMRI focused on poor rural households with children aged 0 to 24 months, a key window for nutritional investments. And it compared the impacts of monthly cash or food transfers with or without nutrition behavior change communication, BCC. The transfers were sizable, about 25% of household income, and the BCC was intensive and interactive and focused on infant and young child feeding practices. Importantly, the BCC aimed to address specific constraints that caregivers in this context face around feeding young children diverse micronutrient-rich diets. That includes caregivers' knowledge, but also their agency and their support from family and community. The BCC also recognized that in rural Bangladesh, these constraints are shaped by gender and climate. In terms of gender, women are primary caregivers, but their agency on feeding practices is limited. Female seclusion norms prevailed, so rural women rarely went outside the home. Husbands do the food shopping. Mothers-in-law often decide the daily menu. In terms of climate, among many other things, weather shocks like flooding often constrain food availability. So the BCC included multiple contextual tailored components to address these. Weekly group meetings for participant women, which was actually very empowering for women since they rarely had social contact otherwise, and where some meetings also invited husbands and mothers-in-law for their buy-in. Twice-a-month home visits for counseling on families' challenges with implementing these practices, including during weather shocks, and monthly meetings with community leaders for their buy-in. So the trial results were quite striking. Transfers alone did improve food security, but not child nutrition. Only the Cash Plus BCC significantly improved child nutrition, reducing child stunting by more than 7 percentage points, mainly through more animal source foods. And we also saw broader benefits. Adult diets improved as well, even during flooding. There were improvements even in women's livelihoods because the BCC had encouraged women to invest in livestock and poultry and homestead gardens, to access healthy foods even within their limited mobility. We even saw sustained impacts through 8 years post-program, reductions in poverty due to the improved livelihoods, and increased women's empowerment and reduced intimate partner violence. The TMRI findings ultimately influenced the design of the Bangladesh Ministry of Women and Children Affairs Mother and Child Benefit Program, which now reaches poor women from pregnancy until their child turns 4 with a model of Cash Plus Nutrition BCC. Next slide, please. So what does this tell us about opportunities to integrate? First, well-implemented transfers paired with carefully tailored BCC can synergistically improve nutrition. As we've heard, transfers address resources. Thoughtful BCC can target knowledge, agency, support. Second, even when a program does not have explicit gender objectives, it needs to consider how gender shapes nutrition practices and constraints. So for TMRI's BCC, improving caregivers' nutrition practices meant needing features that strengthen women's empowerment. There's some examples here, I won't read them all, of how these features also led to other benefits for gender equality and livelihoods. Of note, these components were largely focused within women's traditional domain of caregiving, so they were not gender transformative, but they did, within existing norms, expand women's roles without backlash. And third, programs should acknowledge that climate affects nutrition practices. TMRI's BCC did not center climate resilience. It was not kind of traditionally shock responsive as we think of it now, or promote very specific climate smart practices, but it included very concrete discussions, for example, on accessing and preparing healthy food even during flooding. Next slide, please. To close, just a few considerations and challenges for scaling up. For transfers echoing others, it's key to get the fundamentals right on targeting, size, predictability, appropriate modality, delivery platforms. For nutrition BCC, for it to actually change behavior, it must be intensive, well implemented, and contextually tailored. It should be synergistic with the transfers. So for example, counseling on concrete ways to use the transfers toward nutrition practices. And importantly, it should really align closely with the implementing ministries and their collaborators' resources, expertise, capacity, and workforce. We've been talking a lot about limited resources. When trying to kind of broaden and strengthen benefits within limited resources and capacity, we can consider small strategic design tweaks, like making the BCC responsive to gender and climate, as potentially more effective sometimes than adding many weakly implemented disparate components. And finally, evidence is key for guiding practice. We see this in TMRI's influence on a national program in Bangladesh, but also need to recognize there and everywhere, government uptake is complex, shaped by many interacting factors, including political economy. For example, evidence and ministry objectives are mutually reinforcing. Evidence shapes ministry goals and strategies. Ministry priorities create demand for more relevant research to guide practice, and sustained engagement and trust with local and international partners are key across all of these. These long-term collaborations promote uptake of evidence and also help align research with policy needs. I'm happy to say more in Q&A about how this played out in Bangladesh in terms of uptake, including nutrition being in the social protection strategy, but we'll stop here. Thank you.
Thank you so much, Shalini. That gave us a really nice example from Bangladesh, and especially talking around behavioral change communication, the importance of that it works very closely with any cash transfers, and the importance how gender can shape those nutrition practices, and inviting husbands and elders to come and join some of those counseling sessions. So I think that was really useful, and thank you for that. So we've had 4 very good presentations and some great examples from 3 different countries. We can see a few questions coming into the Q&A chat the box, which we will address just now. But I wanted to give an opportunity to anyone on the webinar who would like to raise their hand and ask a question. And when you do raise your hand, if you could first state your name and organization, and whether your question is directed to a specific speaker. So first of all, we welcome you to come up on the floor to raise a hand. Otherwise, we'll also continue with the Q&A box. So is there anyone who has a question? For any of the panelists or any of the presenters or speakers today? I can't see any hands going up. Okay, so maybe whilst we wait for someone to come in, Abby, I don't know whether there are any specific questions in the Q&A box that we would like to go to. I can see a few very interesting questions there.
Yes, there are a few questions, one from Liul and one from Aline. I'll pose these here. I've also assembled some questions from the Mentimeter, so if we don't have other questions, we can pull from that. So the first question is from Liul, and Liul is actually a consultant of ours, so thank you, Liul. Excellent person. So it's directed towards Tafara, and it's, given the ongoing reduction in foreign aid for nutrition, how do you see the acceptance, scalability, and sustainability of the fresh food voucher initiative in the coming phase of Ethiopia's PSMP? So over to you, Tafara, if you don't mind answering that one live, that would be fantastic.
Okay, thank you very much, Lil. If we look at the fresh food voucher in itself and the research that we have done, it is already part of the government policy in terms of the Sekota Declaration, which is the multi-sectoral approach for Ethiopia. In the PSNP design, the social protection and the reduced resources, it might not be taken in its entirety. It would need to be highly targeted in particularly areas with high malnutrition or very high vulnerabilities for the additional transfer. But there are components, for example, the social and behavior change that can be targeted across the board. In terms of nutrition, there are the gender transformative packages, the male involvement in nutrition that FFV has been promoting, that can be implemented across the board in PSNP without a lot of additional resources. So instead of the actual transfer itself, we can take different components of PSNP. We can also advocate for the transfer for PSNP to be increased a little bit and also put in demand creation for fortified foods, which we are trying to do with the Nutrition Sensitive Social Protection Program. So I hope I've answered your question, Ilo.
Thank you so much, Tafara. The next question we have is from Aline Berweger. Pardon me for mispronouncing your name if I have. Your question is, are these kind of projects usually able to monitor or evaluate how cash transfers are actually spent? And do they also draw on qualitative data to assess how nutritional components, for example, counseling, are understood, perceived, and accepted by communities? So I'm wondering if Nicola and Shalini might be able to take a stab at this, especially Shalini, since your research is focused on evidence and qualitative insight. So over to Nicola first, and then Shalini to follow up, if that's all right.
Sure, thank you. So with the UNICEF led pilot that I talked about, that was the 1,000 days nutrition cash top up, obviously with it going through UNICEF, there's also, and it being a pilot, there's a lot of kind of focus on gathering the evidence as well. I should have read through the impact evaluation before I did this webinar, but it's a really good question. It is a combination of qualitative and quantitative data that is used to kind of give this picture of, how is the money, how are these transfers being spent, and what is the consumption like. But I would also say that I think we've got a long way to go, or like there's a lot more that we can do in terms of really strengthening our MEL frameworks to strengthen the nutrition recommendations. So that was one of the things that came through in the research that the NASC consultants did for us last year, was some recommendations around how we could strengthen the MEL frameworks to be a bit more focused on the nutrition outcomes so that we can properly capture this. So I'm hoping that that's something we can take forward.
Thanks, Nicola. Anything to add, Shalini, from your experience?
Sure. I mean, I agree with everything Nicola said. And I guess on the evidence side, cash transfers are actually one of the types of interventions that have been very rigorously evaluated in the context of pairing interventions with impact evaluations, including randomized controlled trials, where they can compare those who received the program with very similar people who did not. And so from that evidence, we actually have a lot of data on how cash transfers are spent. And what we find by and large is that they are predominantly used to improve food security. There's a lot, part of the reason they've been so much evaluated because there's a lot of fears about them being kind of misused towards alcohol purchases, gambling, and so on. And we really just, in a large breadth of evidence, do not find that. What we do also find is that cash alone often, despite very kind of clearly improving food security, doesn't necessarily improve diet quality or dietary diversity without some kind of more intentional nutrition sensitive component. And so that is where, like, the trial that I described in Bangladesh was actually able to show rigorously that the cash only improved food security, but the cash plus BCC expanded consumption of animal source foods, so like eggs, milk, fruits, vegetables, which actually led to child nutritional status improvements. And on the question about qualitative data, there have been quite a lot of studies which do kind of process evaluations to understand how participants are experiencing the BCC. And it does come through that a lot of things, including like the intensity, the modalities, so like group discussions can be very helpful, but the quality of the facilitator matters a lot. The concreteness of the recommendations, like, are you talking about specific foods and recipes that are relevant to participants? Are you talking about the specific constraints they face? And so the concreteness can really matter. I'll stop there, but happy for other follow-ups. Thanks.
Thanks, Shalini. I see Richard has his hand up, and I believe after that, Iqbal had a question as well. So why don't we go to Richard, and then Iqbal, you can ask and unmute yourself and show your video. Thank you. Over to you.
Thanks very much. On the wasting question, the cash versus wasting, I mean, I think it's very contextual here. What is driving rising levels of wasting and severe malnutrition among children? Is it a lack of purchasing power? When children are very young, they don't need that much food, but they need the right food, and they need to have it at the right time, right quantities, and above all, safely. So in first nutrition survey in Namibia, we found that very frequent bouts of diarrhea among young children were associated with severe malnutrition. This may not be the same everywhere, and it is debated to what extent issues of lack of clean water and safe water supply are related to malnutrition, but it is a potentially high factor. In parts of Botswana, we found that problems with childcare and feeding practices particularly when being raised by in single-parent households were an associated factor, and elsewhere in East Africa, malaria is a factor associated. So it's not necessarily that cash transfers will help, but they might, and I think that has to be looked at, if necessarily rapidly, in context, but above all by talking to families and spending time and trying to understand at family and local level what are the factors associated. One thing I would say hasn't been mentioned is that cash transfers are generally associated with increases in visits to local clinics and the use of health and nutrition services. So, for example, if ORS and zinc are required in order to address diarrhea, cash may help in helping families gain access to health services. Thanks for the question.
Thank you. I believe Iqbal had his hand up. For some reason, I can't see the hand, but I'm told his hand is up. So Iqbal, if you can unmute yourself and introduce yourself and ask the question. Thank you.
Thank you. Thank you. It's a very important sort of webinar. Thanks to all the presenters. It's not a question, just I want to share my experiences with the recent work. And Richard is familiar with the work, what we have done in Bangladesh. With the support from the Cabinet Division, which is custodian for all the social protection program in Bangladesh. We did review 124 social protection program with the lens of nutrition and gender and equity. So one of the sort of findings we had is, so out of this 124 program, 21 had the either currently nutrition sensitive sort of elements in it, or it has the potential or had potential to be nutrition sensitive, in future. So with this 21 program, what we did, we deep dive with further sort of things. We wanted to see how much they cover in terms of their beneficiaries number and how much it cost, to implement this 21 program. In terms of coverage, this 21 program had almost like 70% of the total safety net beneficiaries in the country. So that's the sort of potential we have to reach to the 70% of the beneficiaries who has nutrition sort of vulnerability. Very interestingly, it cost, with the cost of less than 30%, 29% cost. That means to transfer the nutrition program to be more nutrition sensitive and gender sensitive is less costly compared to transfer to other things, So that is very important findings, and that has really motivated Cabinet Division this time. This one of the 9 commitment, the Nutrition for Growth Summit commitment. One of the commitment we have is to transform this 21 project into nutrition sensitive. Already, government has done 12, but remaining 9 will be covered under the upcoming sort of commitment. So that's very important, that we can deliver more with the less cost if we really become sort of very focused and specific and target to nutrition sensitive program. Thanks.
Thank you so much, Kabir Bhai, for those insights. I think we have time for one more question, and that is from Noreen Prendeville. And her question is, do we have more examples of successful high-level advocacy with governments to ensure adequate consideration of nutrition in the design and budgeting of social protection programs? We've tried so many approaches and tools over the years, but what seems to work best? So wondering maybe if Nicola, you'd be happy to give us take a stab at this, given the kind of donor and policy role and Zambia case experience? But if others feel free, want to answer that, you can raise your hand and jump in as well. And then I think
I'll kick it off. Yeah, I've also responded in the answered box to another question, really highlighting that, you know, the nationally led, the locally led coalitions for change, you know, and sort of this social accountability and really sort of working politically to target resources is absolutely key, and particularly, you know, even more so in this low ODA world. So I think we've been working quite a lot on social protection. I think on nutrition we've had less success in terms of kind of our increasing this financing. But one big thing that we did see change this year in terms of the nutrition financing in Zambia is that the government, the Ministry of Finance, sent round a kind of circular, it's guidelines for the ministries to develop their budget proposals. So in this, they asked the relevant ministries to allocate, you know, a specific amount, you know, where are they going to spend on nutrition. And so this was part of like the overall guidelines sent out from the Ministry of Finance. So I think that was a really big win, and that was something that UNICEF had been working on really closely with the National Food and Nutrition Commission. So it was a real success for them. But in terms of what that actually translates to, we don't know if, you know, if it's really going to be directed to the places that are going to have the biggest impact. We don't know if they're just going to like do things that they were going to do anyway, but kind of like target it, you know, tick the nutrition box. So we've yet to see how that works. Over to somebody else with, but I'd love your ideas as well.
Thanks. I'm just looking at time. We have 4 minutes. So Paula is going to close, but maybe do we want sort of a one-liner from any of the other panelists? Or Alex, yeah, were you going to say that? No? Richard.
Yeah, I just want to say elevate nutrition, because if we can convince governments, particularly ministers of finance and so on, of the losses that massive losses that accrue to societies and productivity and future economic growth, of allowing high rates of malnutrition like child stunting and anemia to persist, they'll want to look for ways to invest more purposefully in reducing malnutrition. And social protection does provide a vehicle. The evidence is not comprehensive, but it's significant and growing. And I think panelists and speakers in this webinar have indicated how to go about it based on the best available evidence. It can be done effectively, and we should encourage governments to do more of it in order to address malnutrition costs.
Thanks, Richard. Any last thoughts from Shalini, Nicola, Tafara before we hand it over to Paula to close?
Just adding on to Richard's point, I think GIZ have done really interesting analysis on the cost of, you know, nutrition to the economy, and so obviously that's a big hard-hitting message.
Great, we'll look into that. Anyone else before I pass it on to Paula? Shalini.
Sure, just to say, we know resources are constrained, but we got to keep prioritizing nutrition and prioritizing doing it well. So if we're trying to do too much, let's try to focus on doing what we can within our resources well. Thanks.
Thank you. And Tafara, and then to Paula after Tafara.
Thank you very much. I think nutrition sensitive programs are actually can be done. It's not one of those things that we can continue to talk about and not implement it. It can be done even with few resources. Just to also mention that the Africa Union, together with the different member states, have also done what they call the cost of hunger in Africa. That looks at the economic loss based particularly on stunting. So that's one of the resources that we can utilize over.
Great. Thank you so much, everyone. Fantastic, really, really interesting webinar. I thought it was some really, really interesting perspectives. So yeah, we've heard about there's a very ambitious agenda with the Global Compact. and it's a very challenging context, as we all know, with funds sort of getting squished everywhere and reduced. So we really have to, you know, do more with less and be effective. We have some evidence, as we've heard, and we have some guidance, as you've heard. We need to build on these. We need to adapt them to local contexts. But if we don't explicitly include nutrition indicators in our programs, in national programs, then we will not have all the evidence that we need, because we're not measuring where the effect is. So we absolutely need to do that so that we can keep building on that evidence. And then every country needs to adapt that to their local context of how they can best integrate. Often, I think it doesn't necessarily mean huge amounts of additional funds, but it means being, you know, more strategic, more careful with the funds, you know, putting them into the right place, investing in the right things. And there we do have some evidence. So it's really about getting that message across. I think also the very important point that came out right at the end there is the cost of inaction. So if we don't do it, you know, we are heading for much greater costs in the future. So we've really got to all give that message to our partners and our governments, etc. So I will finish by thanking our 4 panelists, Richard, Tafara, Nicola, and Shalini. Thank you so much. Wonderful presentations. We'll share them with everybody. Thanks to Alex and Abby for all your moderating, and Anna in the background for doing all the hard work behind this. And to Silke, and who's now actually had to run on for another call, but to FCDO and anyone who's still on from FCDO for all your support for funding NASC, for us to be able to help you and work with these countries. And to socialprotection.org folks for hosting us, giving us this opportunity for this fantastic platform. Thank you all so much. We will see you on the next event, and please check our website and check our guidance and all the other guidance that's going to come to you in the presentation when you see it, and share the recording. Thank you so much.
Thank you. Bye-bye.
Bye-bye.